This presentation accompanies Module 3's content. It's a very brief overview of population health in Brazil. As a reminder, I will go over a review of the Brazilian health system, SUS, and its successes. We'll talk about Brazilian population health briefly, successes in infectious and non-communicable diseases. We'll talk about the challenges the country is facing, and I'll share some important information about the COVID response. As a reminder, Brazil is an enormous country, almost the size of the continental United States. It has more than 200 million people, and it's very diverse geographically and racially and ethnically. If you remember from our previous presentation, the Brazilian Constitution guarantees health as a right of the citizens and a duty of the state. Brazil currently has a public system called Sistema Único de Saúde and private insurance plans. Both function in the Brazilian health programs. SUS provides services for no charge at the time of service, but it's funded by federal, state, and city taxes. Many programs have been successful under SUS, including principally the Family Health Program or Family Health Strategy. Family Health Program has increased coverage in the cities from Brazil between 4% to 62% over the last 3 decades. There are more than 5,500 cities in Brazil. So coverage has increased, but of course this coverage is not equal across all cities. Successful control of many causes of infectious disease mortality have happened because of vaccination and access to services for mothers and children. The Brazilian health system, it's right in the Constitution, and the coverage it's achieved has been a major achievement for the country. But challenges remain, and these challenges have gotten worse in the last few years. This table from Castro article that I've asked you guys to read documents demographic and epidemiologic indicators from Brazil between 1990 and 2015. As you can see, there's been rapid population growth in Brazil in these 25 years, but it has slowed down. There's an increase in the population that is 65 and older, and dramatic increase in life expectancy, primarily due to reduced infant mortality. There's improved access to water sources and increased access to sanitation facilities. Some improvements have occurred in deaths from non-communicable diseases, mostly attributed to strict smoking laws and taxes on smoking. There's been increase in road traffic mortality and in suicides. However, neonatal mortality, under 5 mortality, and infant mortality have all dramatically decreased in the last 25 years, as has maternal mortality. If you look at why we think some of these things have happened, there's been a lot of improvement in the health system, increased attendance at births, dramatic improvement in vaccination coverage, and a very solid and successful antiretroviral therapy program for those populations living with HIV. As I mentioned, Brazil is an enormous country, and even though we've seen successes throughout for these various illnesses and diseases that cause death, the distribution of this success is also varied. If you look at the map of Brazil, you can see that the rates of infant mortality are highest in red, and that the rates of infant mortality in the 1990s were higher in the north and the northeast of Brazil. They have improved dramatically across all of these regions, but higher infant mortality still occurs in the north and northeast regions of Brazil. The south and southeast and center-west regions have achieved more success at reducing these infant mortality rates. And that's the regions of the country where Sao Paulo and Rio de Janeiro are located. This is the same data looked at across the entire country and then by the 5 main regions. So just like we have North, South, Southeast, Southwest, West Coast in the United States, Brazil also has regions. They're considered the North, where the Amazon is, Northeast, which is the region of Bahia and Salvador, which we'll explore more, Southeast, South, and Central West. And you can see that in 2014, the entire country infant mortality per 1,000 live birth was 14.1, and this had demonstrated a 70% reduction over the last 25 years. In the Northeast and the North, it's higher, 17.7 and 16.3, although those regions achieved lower and greater reductions. So the North had 60% overall reduction compared to the country, and the Northeast almost 80%. The South, you can see, has the lowest infant mortality rate at 10.7 per 1,000 live births, and they achieved about a 60% reduction in this time. So what you can see is some of the differences and the disparities have decreased during this 25-year period in Brazil. They've also overall improved in the country around child and infant mortality. Brazil was one of the 62 countries in the world that achieved its Millennium Development Goal of reducing child mortality. The United Nations believes that this progress was made primarily through social assistance programs such as the Family Health Program and Bolsa Familia, or the Conditional Cash Transfer Program. That program provides a small amount of cash to mothers as long as they comply with vaccinations and school attendance. The creation of the unified health system has also had a tremendous impact on access to maternal and newborn care and community level care. Independent of successes in reduction in infant and child mortality, Brazil also saw a decline in mortality rates for non-communicable diseases over a 30-year period. Reductions are primarily in cardiovascular and chronic respiratory diseases, and these parallel with falling smoking rates. However, hypertension, obesity, and diabetes continue to rise, as well as neuropsychiatric diseases, and homicide and traffic-related deaths have reached peak levels but may be decreasing. Homicide rates in Brazil remain several-fold higher than in neighboring countries like Argentina, Chile, or Uruguay. There are some partial successes in the Brazilian health, including control of malaria. Malaria is no longer endemic in the coastal regions of the country, with the exception of the Amazon. You can see there's very low risk for malaria outside of these regions. And even within certain states, it's only sustained transmission in certain cities. They've had a dramatic reduction in malaria. Other diseases that have had somewhat successful control include leprosy and yellow fever, although there was recently a resurgence. Brazil has dramatically failed, like many countries in the world, to control a very important infectious disease called dengue. This is a disease also transmitted by mosquitoes like malaria, but it's transmitted by a different vector, and it tends to proliferate in densely populated urban settings. Malaria was introduced in the world globally about 30 years ago and has dramatically spread. As you can see in Brazil, the number of municipalities that had incidence of malaria has dramatically increased, and the cases per 100,000 people varies over time but has remained high in Brazil. This is also the same mosquito that can transmit chikungunya, which is another disease that has similar symptoms, and Zika virus. Part of the failure with dengue is that insecticide resistance in the population has selected for mosquitoes that are even more resistant It killed the majority, but then it selected for these super resistant mosquitoes. Although the Ministry of Health has intensified strategies, there's serious concerns because the model that they have implemented is centralized and it's vertical, which means it doesn't address broader issues. It only focuses on one type of disease transmission. And there's a huge social gradient where the majority of clusters of dengue and disease associated with these mosquitoes is found, principally on the poor outskirts of the cities where sanitary conditions are bad. So there's lots of standing water that contributes to mosquitoes, very densely populated settings, which allows for the disease to be transmitted between people, and harder access to care. Even though the Ministry of Health has intensified these strategies, they haven't necessarily been able to reduce this spread. So successes, infant and child mortality, many infectious diseases, great program for HIV, AIDS, antiretroviral therapy. Some successes in chronic disease like cardiovascular disease associated with reduced levels of smoking, but failures across a variety of both infectious and non-communicable diseases. And of course, in the context of what's happening in Brazil 5 years ago, 3 years ago, last year, and now this year, Brazil is facing an economic crisis. As I mentioned, there was a law that freezes social investments in health and education for 20 years. And if GDP growth decreases, this will provide even less resources for the population. Brazilian population is growing rapidly and it's elderly, and there are very few opportunities to impact their health if you're not continuing to expand primary health care services. There have been a number of researchers that have tried to estimate what the impacts of this austerity measures of reducing finances for health spending will be. There's been a huge dismantling of social policies, so not only is the Brazilian health system frozen, but there's an intention and possibly implementation of reduced other social assistance programs like the conditional cash transfer. There's increasing poverty and possibly expanding malnutrition, which is another place that Brazil really succeeded in reducing malnutrition in the population. There have been a number of studies that have estimated that some of these great successes will be dramatically reduced, and we will see increased child mortality and the longer the economic crisis happens. And of course, all of these studies were done before the COVID-19 pandemic, which has dramatically worsened Brazil's economic situation and its health situation. So in the time of COVID-19, Brazil is suffering greatly. They have the highest rates of infection in South America, and the president has dismissed the pandemic and refuses to close the country. So individual governors and mayors are left to manage the impact in their states. And researchers, health practitioners, and science have gathered together to evaluate evidence and help the country make informed decisions by providing guidance. I share a couple of examples in the next few slides about this. There is an organization of researchers based out of the Federal University of Bahia that has put out a variety of documents trying to help the Brazilian population identify what the successes are, what the potential is, how to use strategy and science to guide their practices. In addition, there's a group of scientists, the Brazilian Association of Scientists, have put out websites and resources. In addition to that, there have been a number of organizations focused on understanding and protecting as much as possible the communities in the favelas. One of those is the Instituto Maria Franco, and this is looking at a map of coronavirus in the periphery. And there's another organization more local that's focused on just these issues in Bahia. In the next few slides, I'll just show you a few examples of what they're doing. In the Herzegovina, which is the first link I shared with you, they put out weekly or bi-weekly bulletins that summarize the status of the evidence. It may provide separate analysis. In this particular figure, it lists the number of confirmed cases and suspected cases up until April 8th. The confirmed cases are in gray, the suspected cases are in red, and you see the states of Brazil on the y-axis. So Sao Paulo at that time is leading. Many other popular and populated states are leading. And this could be because they have more testing or because they were the initial epicenters of the virus. There's lots of evidence to suggest that these cities and the densely populated urban centers are no longer just the only locations where it's spreading, and the disease is moving into more rural settings. Another document from the same organization, Herzegovina, that was produced is a look at access to testing. In the top left, you can see data as of March 20th for total tests performed per million people. And of course, at the time, South Korea is winning. United States was quite far down at that time, and of course, Brazil was very low. But when we think about the size of the populations for these nations, US, Brazil, we really need to think about how many hundreds of thousands of tests have to be done to be able to increase those numbers. And access to testing has been dramatically unequal, both in Brazil and in the United States. The initial rollout of testing in the US was focused only on those who had traveled internationally or had been in contact with people who had traveled internationally. This is also similar in Brazil. The first cases believed to be imported from people traveling from Italy to Sao Paulo, but rapidly anyone exposed to those people were then possibly infected and then never diagnosed. And you can see that the rate of testing for different states in Brazil is quite different. So wealthier states may have greater testing, poorer states may have lower levels of testing. These figures are from a different organization that's about looking at the distribution of the disease geographically in the state and city in Bahia and near the city of Salvador. And you can see that rapidly from the first cases confirmed on the 20th of March to the 24th of April, how rapidly those cases grew and spread throughout the region of Salvador and Bahia. The same organization that's looking at geospatial processes, spatial vulnerabilities, have produced a diagram looking at which parts of the city of Salvador are more at risk, and they evaluate where the virus is, the possibility of being exposed, that's your potential exposure, and then your vulnerability. What's your age? What's your income? Do you have access to water and sanitation? And then they put those together to estimate risk. And you can see in this graph, there are certain regions of the city of Salvador that are likely more at risk. These have high density populations, low access to resources, perhaps a larger portion of the population that is elderly, etc. So this last set of references is for you to have access to the information that I shared, some of the references, some of the materials that we discussed earlier, or the readings, and others will be made available either through links or additional reading documents. Many of the slides I used in my presentation were drawn from Dr. Susan Martins Pereira, her presentation that she gave to the students in Bahia in 2018 about population health situation and needs in Brazil.